transparently by a public company with code open to public oversight and data anonymized, then people won't trust the system and it risks failing. But does he agree that only a community-led process of human contact tracing can provide the fine-grained and reliable data that such an app would depend on? And will he learn the lesson from the over-centralized organization of the testing approach and instead adopt a more decentralized approach for contact tracing using local environmental health officers and PHE's regional outbreak management teams?
Secretary of State.
Well, Mr. Speaker, I agreed with the first 2 points, which is the importance of people for contact tracing as well as technology. And in fact, the two working hand in hand will be the most effective approach. I also agree with the need for the ethicists around this. We are giving up a huge amount of our liberty, all of us, because of social distancing. And so measures to reduce social distancing, for instance, through the use of data, need to be considered in that context. But we are making sure that that's done in a way that can provide assurance to people with concerns in that area. On the final point, we've got to make the appropriate use both of national and of local resources. In testing, for instance, organising drive-through centres across the country and home testing is inevitably an issue that needs to be done centrally, and then other testing laboratories are organised locally. It's about getting the best of both worlds.
Going across to Laura Trott. Laura Trott.
Thank you, Mr. Speaker. The Secretary of State has talked today about the test, track and trace strategy, and he's indicated that the effectiveness is determined by the incidence in the community. Can he give us guidance on what this incidence level is and when, based on current modelling, we might achieve it?
Well, the current level of incidence is unknown until we expand testing yet further, but it is far, far higher than where it needs to be. Although, as I said, we are at a peak, and we have high confidence that we are at a peak in this disease. But obviously, we need to see that come down. And it's a question of degree. The reason I'm not giving a numerical answer is because it is a question of degree. The fewer new cases, the more effective test, track and trace are as a way of keeping the disease down, and therefore the more of the social distancing measures can be lifted. This is all a question of degree, and we do not have an answer to the question of when that will all be doable, because we have not yet seen the curve start to come down, and we don't know the pace at which that curve will come down under the current social distancing rules.
Going across to Barry Sherman. Barry Sherman.
Mr. Speaker, can I just say to the Secretary of State, who I've known ever since he came into Parliament, I know he's been unwell, but he would expect me to be robust in my question. And can I tell him that as a Member of Parliament for Huddersfield, looking from the Yorkshire point of view, I think the management and leadership of this present crisis has been shambolic. I believe that we should never have been in the position where we lag so far behind Germany, a similar country to ours, and behind many of the other European nations we're predicted to be the worst. 823 people died. That's 2 jumbo jets of crashes. That's a large number. And the fact of the matter is, every time the Secretary of State speaks, he thinks it's a triumph what he's doing. I believe that it is a shambles of leadership and management. I think we're letting down NHS staff, and they have been let down. And indeed, I'm particularly cross and particularly angry at the fact that I understand that those early whistleblowers were so lent on and threatened with disciplinary action that was to stop brave young doctors and nurses standing up and telling it what it was like on the front line. Is that the fact? And can he get his act together? Because many of us do not believe that he's telling the truth to the people of this country.
Secretary of State.
We want to be united.
Secretary of State.
Mr. Speaker, I think that the member who just spoke completely misses the tone and has missed the point of what we're trying to do as a nation to pull together in this time of grave difficulty. It is absolutely the case that our prime goals at the start of this crisis, to flatten the curve and to make sure that the NHS always has the capacity to treat everybody who needs it, those two objectives have thus far been met. Of course there are challenges. There are enormous challenges. Distributing 1 billion pieces of PPE is not straightforward. On the point he makes about whistleblowers, he is completely wrong to say that it is not possible to raise an issue within the NHS. By contrast, thousands of people do it in public and in private every single day. So it saddens me that a member of this House might get the tone wrong so badly. There are reasonable questions to be asked, and we try to answer them in a reasonable way, and I think that's the best way for this House to proceed.
We're going across to Sir Gary Streeter. Sir Gary.
Thank you very much indeed, Mr. Speaker. Can I put on record my personal thanks to the Secretary of State for his quite remarkable personal efforts over the last few weeks. I think he's doing a terrific job in unprecedented circumstances. And I welcome what he said about non-COVID-19 treatment earlier this afternoon. Will he, as soon as possible, please set out a clear plan to enable elective surgery to take place once again in hospitals that do have capacity, so we don't build up a nasty backlog of unmet health needs? Thank you.
Secretary of State.
Yes, this is an incredibly important issue. We want to get the non-COVID-19 treatment back up and running as quickly, as safely possible, and of course putting in place the arrangements to make sure that when people do go into hospital without COVID-19, then they aren't infected by people who are in hospital with COVID-19. That segregation is a very important part of our considerations. The answer is yes, within very short order, we will start to restart the NHS. He talks about elective operations. That's an important part, but so too is people presenting themselves and giving people the confidence to call their GP, or if it's urgent, call 111 if they have a problem. Because we know, for instance, in cancer that early diagnosis is critical, and I want people who think that they've got a risk to come forward for that treatment.
Going across to Rosie Cooper in Lancashire. Rosie Cooper.
Thank you, Mr. Speaker. In a statement today and at the Health Select Committee, the Secretary of State has implored cancer patients to come forward and assured them of treatment. Yet since the Health Select Committee, I've been inundated with messages from all over the country from desperate patients whose treatment has been stopped, interrupted, or not even started because of COVID-19. So I would like to ask the Secretary of State what he's doing to ensure that there isn't a gap between his welcome words and what's actually happening. Can he guarantee that treatment will go ahead and give patients confidence that we've got COVID-free hospitals by frequent and widespread testing of staff? And finally, that ensuring death in service benefits will be paid to all healthcare workers who've died of COVID-19, both now and retrospectively.
Secretary of State.
Well, thank you very much, Mr. Speaker. I would just like to be absolutely clear, as I was at the Health Select Committee, which I thought was a very good discussion, about this point about cancer treatment. There is some cancer treatment that it is clinically inadvisable to undertake during an epidemic like this, because if you take somebody's immune system down to very low levels, then that puts them at significant risk. So I can't give the guarantee that all cancer treatment would go ahead, because even though we have capacity now in the NHS, and we have confidence that that capacity will not be overcapped by the virus, the virus is still at large in the community. So there are some cancer treatments that it is clinically inadvisable to undertake now, especially around immunotherapy. Having said that, yes, we do want people to come forward, and we do want to have as much cancer treatment as possible going ahead, that where it is safe to do so, considering the impact of the virus. And that's why I do want people to come forward if they have a risk, and then we will treat them as best as we possibly can within the constraints of the fact that we have a very serious virus stalking the land.
Going across to Luke Evans.
Thank you, Secretary of State. Frontline workers in things like ITU and care homes are used to death. That's part of the job, but not on this scale and not in these circumstances. What is he and his department doing to support the mental health of frontline workers both now and in the future when the pandemic passes?
Secretary of State.
This is an incredibly important question. We've put in place a helpline for all frontline workers in the NHS to make sure that they have the support that they need, and I will make sure, working with the Honourable Member and others, I'll make sure that that support stays in place long after this crisis is over.
We're going across to Patrick Grady. Patrick Grady.
Thank you, Mr. Speaker. Will he join me in welcoming the extraordinary effort by all those involved in getting NHS Louisa Jordan in Glasgow ready to receive patients if needed? Can he outline what discussions he's had with the Scottish Government counterpart about the different operating model between NHS Louisa Jordan and NHS Nightingale in London? And can he outline what steps he's taking to address the long-term nursing shortages in England, especially flight of nurses from the European Union, that reports suggest are impacting on the operation of NHS Nightingale?
Restate.
I'm terribly sorry, Mr. Speaker. I don't recognise those reports at all. There is no impact at all of Brexit on our coronavirus response. And the good news is that we've had thousands of nurses and other clinicians come back into service since this crisis started.
Across to Kevin Hollinrake. Kevin Hollinrake.
Thank you, Mr. Speaker. Daniel Falouche, who's a professor of infectious diseases based in Shanghai, points to the fact that part of China's very successful efforts to control the virus was immediate quarantining, in that people go to a clinic, they're immediately tested, they wait for the results, it's a 15-minute test, and if that test is positive, they're quarantined there and then. Would the Health Secretary consider this as a potential for a very significant mitigation as we open up our economy against the chances of a second wave of this virus?
Secretary of State.
Well, of course, we look at all options. What I would say is that under the test, track and trace strand, of course, the policy advice on how people should isolate if they test positive is an important part of that. We have that advice currently in place, but of course test, track and trace really does rely also on self-isolation to make sure that it's implemented properly. Test, track and trace is about finding out who needs to take action, and then they do need to take the action that is currently set out.
We now come to the final question. Maria Riedel.
Mr. Speaker, on the 11th of March, I asked the Secretary of State whether it was right to allow over 3,000 Atletico Madrid fans to travel to Anfield to watch a Champions League game when they couldn't have watched their team in Madrid because attending football matches there was banned because it was a COVID hotspot. The Liverpool City region now has a higher than average incidence of COVID-19 than the UK and English average. The Mayor of Madrid, the Director of Public Health for the City of Liverpool, have both said it was a mistake to let the match go ahead, and the government's Deputy Chief Medical Scientific Advisor has said the idea that there's a link is an interesting hypothesis. Does he now admit that the government was behind the curve in banning such gatherings, and will he undertake to investigate any possible link between that match and the higher incidence of COVID in Liverpool?
Secretary of State.
Well, this is, of course, a question for the scientists, and what matters now is making sure that whether people are in Liverpool, across the northwest, that people get the treatment that they need and that we get the curve under control.
Order, order. That concludes scrutiny proceedings for today. Before suspending the House, I wish to place on record my thanks, and I believe the thanks of the whole House, for the commitment, the ingenuity of all those who have made today's proceedings possible. I can say almost everything has gone smoothly, but we will learn lessons as we do this more. Firstly, following remarks made yesterday in the debate on hybrid proceedings, I wish to explain how I will deal with points of order from Monday. Members must give notice of a point of order to my office before the start of sitting. If I am satisfied that the matter to be raised is a genuine point of order, the members will will not be called to raise it. Instead, I will make a statement at the conclusion of scrutiny proceedings, setting out the point of order the member who has raised it and my ruling on it. I will now suspend the House for 15 minutes to allow members to safely leave the chamber and for broadcasting colleagues to make the necessary technical changes to our physical-only proceedings, and thank all who have taken part. Order! Order! Oh.